There's an access to care issue in California. A promise of universal care without adequate physicians is an empty promise. Our population in California is becoming more diverse. It has very specific, unique needs, and oftentimes it may even have very specific chronic conditions. Our providers have an opportunity to practice in underserved areas with underserved communities. When we have physicians in underserved communities, working with rural communities, working with urban underserved communities, it's an opportunity to improve access to care in those communities.
California is the most populous state in our country, and it is continuing to grow. However, there is a shortage of physicians, but not only just physicians overall, but physicians that are specifically going in to practice primary care, going into rural medicine, for example.
We need more primary care physicians. We need more internal medicine physicians. We need more obstetricians, pediatricians, and of course, family medicine.
We know that with graduate medical education, wherever residents train, they're actually more likely to stay and work in that immediate community or surrounding community.
It's important to provide expanded graduate medical education programs in California. What we know is that the majority of residents end up practicing within 100 miles of where they did their residency. Our programs have an opportunity to practice in underserved communities. They can train and learn about social determinants of health, and in essence find ways to continue to be culturally competent and diverse.
The one thing that we have to have, we need more physicians. And in order to have more physicians out in the workforce, we have to train them. And in order to train them, we have to have the finances to be able to do so.
CalMedForce is a program that incentivizes residency training programs to expand the number of residency positions that they have. Our focus at CalMedForce is to train the next generation of primary care and emergency physicians. Primary care is defined as family medicine, internal medicine, pediatrics, and OBGYNs. It's about training with respect to social determinants of health. It's about incentivizing and producing more culturally competent and diverse providers. It's about ensuring that when we talk about access to care, we're not only thinking about the number of physicians and deploying them in those underserved communities, but it's also thinking about it from a patient population perspective.
The CalMedForce grant is excellent for a brand new program such as ours. We need the residents, we need the funding, we need to be able to have our residents train well so that they can get out into this rich community and take care of our patients.
Any programs, anything that's going to support kind of growth in this direction for our physician workforce, to grow our primary care docs, to grow, to meet the needs and the shortages and the diversity. And I think I would just like to say that these programs matter.
We are looking to expand our number of resident complement from 6 to 10. And the grant will allow us to be able to do that. Our residents want to care for Californians. And with the funding there, we can continue to do that.
We're honored to work with our applicants and our awardees, and we really want to thank those GME residency programs for doing the hard work of incentivizing, sustaining those residency programs, as well as expanding residency training opportunities. What we know is that a CalMedForce grant is a gift upon a gift that keeps giving. It is an opportunity to incentivize those programs. Those programs in turn train residents and fellows in underserved communities, and those residents are more likely to stay in those areas. So we want to be able to thank those awardees and say thank you for the good work of training and working with the next generation of physicians and providers.